Back now on Triad Today, and it's my pleasure to introduce a very special guest, Jay Paul, our director. If we can meet Dr. M. Dean Harris. I'll try to find out what the M stands for later. Forsyth Cardiology, and he's here to talk about a serious topic. And welcome, Doc. How you doing?
Thank you, Jim. I'm honored to be here.
We hear a lot about breast cancer and other cancers, but what should women know about heart disease, for example?
I think that you could say that heart disease in women has been sort of a stealth disease. It's flown under the radar. For many years, I don't think we understood the severity or even the prevalence of it as now we are beginning.
And didn't get a lot of attention.
True. But we now know that as many as a third of women and about the same number of men eventually die of heart disease.
What are
numbers are almost exact.
Yeah, what are the risk factors for heart disease?
There are a number of risk factors, such as high blood pressure, diabetes, high cholesterol, cigarette smoking. Some that we can alter, such as our family history, our age, and our sex. And then there are, well, those I would say are the major ones, although I think in recent years we've become more concerned with obesity and activity levels.
Yeah, we're even concerned about childhood obesity now, trying to prevent those kids from having trouble later on, the young men and women, 9 and 10 years old that are obese. Are the risk factors the same, the ones you just rattled off to me? Would they be the same identical risk factors for men as well as women?
Turns out they're very similar, as a matter of fact. High cholesterol and various types of lipid abnormalities. Lipids are compounds that are similar to cholesterol. They're all very similar. There are two that I might mention that really stand out for women. One is diabetes. We think that the risk that diabetes poses for heart disease for women is a lot greater than for men. In fact, it may increase the risk of developing heart disease by 5 to 7-fold for women.
Oh, man.
Whereas it's only 2 or 3-fold for men.
That's very surprising and disturbing. What are the signs of coronary artery disease in women? What can you tell is going on?
Probably similar. Chest pain is very common in both sexes. It turns out that men are more likely to have certain presentations. This goes back to the stealth issue that I was talking about.
Right.
Men are more likely to present with heart attacks or, worst of all, sudden cardiac death than women. Women are more likely to present with pain alone. Women often have symptoms such as fatigue. They may have atypical sorts of pain that are hard to quantify. And
you're not always sure sometimes. So of course the best thing, I'm probably jumping the gun, but the best thing of course is to go to the emergency room if you're at all unsure about what you're...
Well, be suspicious, and I think this is what the Heart Association is focusing on now, to make women aware.
What are some of the best preventative measures that women can take?
We have a number of superb medications now for management of factors such as high cholesterol, such as high blood pressure. I would say the most important 2 risk factors that individuals can take in their own hands would be exercise and learning something reasonable about diet.
Any new diagnostic tools or things on the horizon or that we have now?
As far as diagnosis, I would say the tools we've had for some time, stress testing of different types, are pretty much the same. They've been a little refined. And there are some imaging techniques. We've gotten better with echocardiograms, with MRI and CT scanning.
So do the exercise, eat healthy, and don't wait around if you get some of these symptoms we were talking about. Let me put up on the screen cornerstonehealth.com. That gives you lots of information about this and many other topics. And we thank Dr. Dean Harris of Forsyth Cardiology and the folks at Cornerstone. Thanks for doing this.
Well, thank you very much, Joe.
We'll be right back after this.